Imagine being 7 years old, waking up in a hospital bed. I mean, there are loud alarms, harsh fluorescent lights, and just this rotating cast of strangers walking in to poke and prod you.
Right, doing painful things to you.
Exactly. Your choices are totally gone. Your control is gone. And in an ICU, we usually think of absolute compliance as, completely necessary to save a life.
Yeah, but when the patient is a kid, stripping away that control can cause some really deep psychological trauma. When they lose all agency, their brain literally perceives it as a mortal threat.
Which triggers the survival brain.
Yes, the amygdala activates.
Huh.
They go straight into fight, flight, or freeze. And that's why the insights we're exploring in today's deep dive are so vital. Pediatric intensive care is actually undergoing this radical shift.
It's moving away from just demanding obedience, right?
Right.
Towards actively building empowering partnerships with these kids. And whether you work in healthcare or, you're a parent dealing with tantrums or you just want to learn how to navigate high stress resistance, this is basically a masterclass in restoring a person's sense of control.
It really is. It changes everything.
So how does a nurse even begin to break through that wall of pure terror?
Well, it starts the absolute second they walk into the room using what's called a shift-change partnership checklist. It's 4 deliberate steps to establish psychological safety.
Because without trust, you can't have a partnership.
Exactly. So step 1 is the introduction. The nurse looks right at the child and literally says, "You are the expert on you. Let's be a team."
Wow. That is such a profound shift from the whole I'm the adult, listen to me dynamic. But words only go so far, I imagine.
Right, which brings us to step 2, the goal check. The nurse actually asks the patient what they want to achieve that day.
Like what?
Maybe it's just, "I want to sleep for 2 straight hours without being poked." The nurse then works to fit the medical tasks around that personal goal. It proves their priorities actually matter.
Okay, but they still have to tackle the painful stuff eventually, right? How do they handle the things the kid is absolutely dreading?
That's step 3. They map out the no-go zone. So they pre-plan for the absolute hardest part of the day. By talking about it early, they remove that terrifying element of surprise.
Oh, because anticipatory anxiety is, like, often way worse than the procedure itself.
Exactly.
Hmm.
And finally, step 4 is the communication key. They agree on a physical signal, like raising a hand for when the child needs a quick break.
That makes total sense. I mean, when you're panicked, sometimes your vocal cords just freeze. It's kind of like, well, if you're terrified of heights and someone forces you onto a roller coaster, you feel completely trapped.
Right, you're helpless.
But if they put you on that same coaster and give you an emergency brake you can pull at any time, the ride is still scary, but you have some control.
That is the perfect analogy. And once that emergency brake is established,
Yeah.
the nurse uses this framework called the My Care, My Way autonomy menu. It practically hands back control.
So giving them specific things they can actually rule.
Yeah, exactly. Like controlling their environment. Do they want the lights dimmed, the door open or shut? It even lets them control their procedure participation.
But that has to change depending on the kid's age, right?
Absolutely. For school-age kids, so like 6 to 12,
Yeah.
you treat them as co-pilots. You give them a job. "Can you hold this medical tape for me?" It makes them part of the team.
And for the older ones.
For teenagers, 13 and up, you treat them as consultants. You negotiate their routines to respect their privacy.
Okay, let me stop you there, though. We're talking about giving them scripts with realistic choices. Like for medication, saying, which pill first? Do you want to hold the cup?
Right, giving them process choice.
Or for hygiene, want to wash the parts you can reach. But, I mean, if you look at a grumpy teenager and offer them a choice between a yellow or green toothbrush, instead of asking if they want to brush at all, aren't they just going to roll their eyes?
Oh, for sure. If you deliver it like a cheesy trick, they will see right through it. But it's not about tricking them. It's an authentic acknowledgement of boundaries.
So you're saying the what is non-negotiable, but I respect you enough to give you a say in the how.
Exactly. Controlling the process, not the outcome. It literally signals to their nervous system that they aren't under attack.
Even with the best menus, though, a child in constant pain is eventually going to hit a wall. What happens when a nurse faces just utter screaming refusal?
You don't force it. You use the 2-minute reset.
Okay, what's that?
When severe resistance hits, the nurse steps back to eye level and validates the frustration. You say, "I'd be mad too." Then you take a strict 2-minute non-medical pause.
A complete pause.
Yeah, you talk about their dog, you listen to a song, you just stop. and you re-enter the task together.
Wait, hold on. In a frantic ICU, alarms are ringing, people need critical care. Do nurses really have time to just stop everything for 2 minutes of music?
It sounds crazy, I know, but think about the alternative. Physically fighting a terrified, thrashing patient takes way longer than 2 minutes.
And it traumatizes everyone.
Exactly. That pause is a calculated clinical intervention. It lowers their heart rate, clears the cortisol, and lets the task proceed safely.
Wow, it really changes the whole dynamic from doing to a patient to doing with them, finding those tiny pockets of autonomy.
And that physiological reset gives the brain a chance to recognize it's safe, which is what makes healing possible.
That is just incredible. And it leaves you with something pretty powerful to think about. If these partnership strategies can de-escalate terrified patients in an ICU, how could you apply this predict, plan, proceed model to diffuse everyday power struggles in your own home or workplace?
That's a great question.
The next time you face a brick wall of resistance, just remember you don't have to force them on the roller coaster. Just ask them who's holding the brake.